everyday Americans will be hurt by the one big ugly bill. We're here on the floor of the House of Representatives debating legislation in the middle of the night with millions of Americans having gone to sleep anxious about what would happen. Here on the floor of the House of Representatives, understandably concerned that their voices have not been heard in this debate, that their pleas for compassion have been overlooked. Many of my colleagues, Mr. Speaker, on the other side of the aisle have chosen not to hold town hall meetings, not to hear from the voices of the people that you're privileged to represent. But we've embraced the American people. We haven't run from the American people. House Democrats will continue to run toward the American people and lift their voices up. Lift their voices up. And so, Mr. Speaker, I'm going to take a little time to share some of the stories of the American people. Voices that might otherwise be excluded from this debate. But we're not going to let those voices be excluded. We will ensure that these voices are heard. We will continue to do everything we can to bring those voices to life, here on the House floor and beyond, to stand up for the best interests of everyday Americans. And we've heard from many of them throughout this process. I'll share just a handful. With Medicaid expansion, I now qualify for Medicaid. Without insurance, my monthly bill for my 3 injectable drugs would be $3,000. $36,000 a year. And that doesn't include any of my other meds or my medical appointments. Who has that kind of money? That's Charles, who lives in Alaska, district represented by Congressman Nick Begich. Medicare and Social Security keep me alive. I'm surviving on about $13,000 a year, most of it from my Social Security checks. That's just enough to afford my rent, utilities, and food. Without Social Security, I would be homeless. And if Medicare did not pay for my medications, if I had to pay full price, I wouldn't be able to survive. There are so many other seniors who are in the same boat. Without these programs, seniors like me would die on the street. That's Paula, who lives in Arkansas's 2nd Congressional District, represented by my colleague, Congressman French Hill. My son is a 25-year-old young adult with profound nonverbal autism who needs 24/7 support. Our family has relied on Medicaid from the time he was 2 years old, when he began early intervention services. At 3, when he was diagnosed with autism, a private health insurance denied him coverage for his pre-existing condition. Medicaid stepped in to provide health care. From that point until today, home and community-based services through Medicaid have been vital to our son's health and well-being. Medicaid also helped his school district pay for medically necessary therapies at school. Our son is thriving and healthy, and our family can support him at home because of Medicaid. That's Robin. She lives in Arizona's 1st Congressional District, represented by David Swiker. These are stories from everyday Americans who've written to us to say to this Congress, stand up for our health care, Mr. Speaker. Don't stand up for billionaires. Stand up for everyday Americans, for our health, for our safety, and for our well-being. Gwendolyn from Arizona, she also writes, she says Medicaid is the difference between my son being healthy, happy, cared for, and social, versus being at home with aging parents who struggle to physically provide the care that is required daily. Medicaid funding means my son receives the incontinent supplies he needs, the internal feeding supplies he needs to live, and medications that his primary insurance won't cover. Medicaid matters because without it, my son and millions of others like him may not survive. Let me speak directly to Gwendolyn from Arizona. Her representative may not be fighting on your behalf. As House Democrats, we're here to say to you, we agree. Medicaid matters, and it must be preserved. It must be preserved. Because Medicaid matters to millions of people all across this great country, to children, to seniors, to people with disabilities, to women, to families, to people in every corner of the United States of America. Yes, Gwendolyn, Medicaid matters. And if your representative won't fight for it, we will. Brenda? Says to us, my youngest child is a nonverbal 43-year-old female with autism who has been on Medicaid since she was 12. She's had 3 major surgeries and 6 or more outpatient surgeries, all made possible because of Medicaid. We would not have been able to get our daughter what she needed if it wasn't for Medicaid. She also has a seizure disorder and is on several medications. Some of them are way too expensive for us to afford on a blue-collar income. Finding doctors that are good and accept Medicaid are few and far between. But some doctors are better than none. And the only way our daughter will get any medical care at all. She is one of the most vulnerable people in society. And caring for her is a full-time job. For myself and her father, who are both retired and are full-time care providers for her. I am not sure why anyone would want to take this help and service from people whose very life depends on the help it provides. That's a powerful and profound question. Why would anyone in this House vote to take away Medicaid from the American people amongst the most vulnerable here in the United States of America? Brenda from Arizona lives in Arizona's 6th congressional district, represented by my colleague, Congressman Juan Ciscomani. Garrett, also from Arizona. I'm still in the A section right now. So strap in as we make sure we lift up the voices of everyday Americans all across this country. It's important that we take note. This isn't abstract, taking away health care from the American people. It's concrete, it's real. It has devastating implications. Garrett says, I was diagnosed with cerebral palsy at birth. Cerebral palsy at birth. Thanks to Medicaid, I was able to undergo multiple surgeries that significantly improved my ability to walk, transforming both my mobility and daily life. Relying on Medicaid, SNAP in the past, and SSI, I worry about what would happen to me and my friends if these programs were taken away. Without them, I wouldn't be able to keep up with doctor's appointments, medications, and transportation. Earlier today, my distinguished colleague from the great Commonwealth of Virginia read a passage of Scripture, one of my favorite passages of Scripture, Matthew 25 and 35 through 40. And later on this morning, as I continue my remarks, perhaps I'll have an opportunity to go a little deeper into the meaning of Matthew 25 and 35. What I can say is that all of us should be trying to lift up the least, the lost, the left behind, the poor, the sick, and the afflicted. Garrett tells us, I was diagnosed with cerebral palsy at birth. And the first thing that jumped out to me when I read this was that we're all God's children, and we should be looking after all God's children to the best of our ability, not running away from them and undermining their quality of life. So Garrett, we're going to continue to stand up and work hard on your behalf. Nancy from California. That's a great name, Nancy from California. Nancy from California writes, my two special health needs, former foster children, depend on Medicaid for a dizzying array of health services. ranging from over 20 pediatric medical specialists and palliative care to behavioral health and occupational therapies. They both have rare, incurable, disabling diseases that require IEPs to navigate school. She continues, but I want to pause right there. I think that's an important point, talking about her children and the IEPs to navigate school. We should be looking out for children like Nancy's two beautiful former foster care children, her two special health needs children, as she calls them. It's one of the reasons why the Department of Education is important. Public schools are important. Nothing in this bill supports public education. In fact, this one big, ugly bill represents an attack on public education. And that is not consistent with what we should be doing as we prepare to celebrate our 249th birthday and lifting up this pursuit of happiness. Nancy continues, the ACA protections for pre-existing conditions and the removal of lifetime caps are also essential. My youngest child requires medical care that I simply cannot afford, costing between $750,000 and $1 million per year, depending on how stable her health is. I work part-time, but the caregiver burden is too demanding for me to maintain a full-time job. As a single widowed mother, Medicaid has become a lifeline for keeping my kids as well as possible. Nancy lives in California's 1st congressional district, represented by my colleague, Congressman Doug LaMalfa. Laura lives in the Central Valley of California, an area of the country with the highest concentration of Medicaid recipients. The highest concentration of Medicaid recipients. I've been raising my 6 grandchildren for 15 years, and they are coming of age, but not many jobs are available. Also, my 16-year-old grandson depends on Medicaid and EBT to survive. He takes many medications a day. If you're not going to respect my ability to speak, respect the story that I'm telling on behalf of Laura. Respect her story, because her story matters. Her story matters, and the American people matter.
We need order.
He takes many medications a day. I'm too old to do anything but take care of him. I can't imagine choosing what medicines he gets or who gets to eat. Please reconsider for the people who need medication that is necessary for survival. Universal access to food and meds would lighten the worry that we carry. Not having to worry about food and medicines gives me more time to care for my 26-year-old grandson, who is quadriplegic due to a head-on collision last year. Please don't make him suffer anymore. He needs food supplements and many medications every day to survive. Laura lives in California's 22nd congressional district, a district that is represented by my colleague, Congressman David Valadao. Just happens to be the district that has the highest concentration of Medicaid recipients in this country. Laura, I don't know what your Congress member is going to do. Every single House Democrat is fighting hard to protect your Medicaid. We value you, and we're working hard to defend you. Jackie is from the Orange County area of California. My son is 34 years old. He has Down syndrome and autism, and lives at home with his aging parents, Dad, 82, and Mom, 71. His biggest joys in life for him are his day program and eating out. How small are his desires? And you want to take that away from him. He requires much care. Bathing, shaving, washing hair, brushing teeth, dressing, etc. His aging parents can do the job required for this 100% of the time. He has great caregivers right now, and they have been with him for many years. Now you want to take that away from us? Please know that Medicaid Medical is what allows us to keep him in a safe and happy environment that he will not get anywhere else, and for a whole lot less money. Why should that change for him? Jackie asked. Please be respectful of families who have high-need family members who need these services. Thank you for allowing me to speak on behalf of my son and everyone who loves him. Jackie lives in California's 40th congressional district, a district represented by my colleague, Congresswoman Young Kim. Kayla writes to us from Colorado. At 26, I was diagnosed with brain cancer, a discovery I was only able to make because of Medicaid. Without it, I wouldn't have been able to get the treatment I need to survive. That diagnosis changed my life. And while I am grateful to be here, I can no longer work. Now I rely on disability benefits, food stamps, just to get by. These programs are the only reason I'm able to live. Without this support, I don't know how I would manage. Kayla lives in Colorado's 2nd congressional district, a district represented by the Assistant Democratic Leader, Joe Neguse. Kayla, I can say to you that your Congress member is fighting hard to protect you, just like every single member of the House Democratic Caucus. Ashley writes to us from Colorado. She says, my life was saved by the Affordable Care Act. Because of this act, I was able to stay on my parents' health insurance when I couldn't get any coverage. At the time, I was dealing with a myriad of health issues and would eventually be diagnosed with multiple chronic illnesses. Because of the ACA, when my husband and I were married, I was able to be added to his insurance without being denied due to pre-existing conditions. Prior to the act being passed, I was denied coverage and care many times. If I was even approved for coverage, it cost me thousands per month in premiums. I was being penalized, Mr. Speaker, for being sick. There were many times when I could not get coverage that I had to choose between which prescriptions I would get to have or whether I would get all my meds or the groceries we needed. You know, there are far too many people in the United States of America right now, before experiencing the devastating consequences of this one big, ugly bill, who have to choose between putting food on the table, clothing on their backs, access to medication, or paying the rent. The United States of America is the wealthiest country in the history of the world. Not a single hard-working American taxpayer should ever have to choose between food or medicine or rent or putting clothing on their back. Not a single hard-working American taxpayer should ever have to make that choice.